Hey, welcome to this 5-minute case study on hypoglycemia.
Hi, my name is Ashley. I'm from the surgical specialty unit. I recently took care of a patient who was hypoglycemic at 5 o'clock in the morning. He was at 69. I pushed D50 and he came up to 164. I then proceeded to call the doctor and I recorded it, and they decreased the Lantus that day, and he had no more episodes after that.
So here's Ashley's patient. This is the glucose management screen where you can see all the blood sugars and the insulin and a lot of things that are helpful for looking at diabetes management for a patient. So his blood sugar was 69. She gave him the IVD 50 and his blood sugar came up to 164. This patient was also on continuous tube feeding at 90 an hour. He was not eating. So he was getting 70-30 3 times a day on the TPN tube feeding insulin order set, and then he would get Lispro every 4 hours as needed on that same order set. He was also on Lantus once a day. So this patient pre-admit was on insulin at home, so it took quite a bit of insulin here in several different types, as you can see, to get the blood sugars under control. So it's part of the orders to call the provider to tell them about the hypoglycemia, but I think it's really helpful if you look to see what you thought the causes were or the risk factors, so you can have that quick discussion when you call them. And in this case, the glargine had been increased to 14 units once a day. It had been 12 units once a day the night before. Blood sugars were running a little bit high, so they increased it. The other thing is that this patient had their tube feeding stopped at midnight. It had been 90 units an hour, and then it was stopped at midnight. So I think those were a couple of contributing factors for the hypoglycemia that happened early in the morning. So the other thing you want to know is what's kind of the plan for preventing repeat hypoglycemia. Repeat hypoglycemia is associated with increased length of stay and mortality, so we certainly don't want to continue to have hypoglycemic episodes. So for most of our patients who are on insulin, that means a change in their insulin regimen. For this patient, Ashley's patient, they decreased the glargine back down to 12 units. Here's a quick reminder of our hypoglycemia orders. So, if the blood sugar is less than 70 and they can take oral, they get 30 grams of carbohydrate, which is 8 ounces of juice or soda. They could have 30 grams of glucose gel. If they can't take oral and they have an IV, you give them IVD 50. And if they can't take oral and they don't have an IV, then you can give them glucagon. Whatever you treat with, you need to recheck blood sugar in 15 minutes and then call the provider and have that conversation and then make sure and document all that stuff. So I think the takeaway on this 5-minute case study is to really avoid repeat hypoglycemia. It increases length of stay and mortality. And per our hypo orders, we treat, we recheck in 15 minutes, and then make sure and call the provider and have a quick discussion about the hypoglycemia, the causes, the risk factors, and maybe kind of what's our prevention so we don't have more hypoglycemia. Hey, thanks for taking the time to listen to this 5-minute case study on hypo. Let us know if we can help you in any way with the diabetes care for your patients.